start when you're ready.
Okay, as most of you know, my name is Jennifer, and I'm enrolled in a capstone course through Vincennes University, and I was assigned to present like a research proposal. The topic that interested me was the Braden scale and how effective it is. So that's what I will eventually do my research on. Okay, so the development of pressure ulcers is increasingly becoming a problem in healthcare. Affecting more than 2.5 million people annually, pressure ulcers may occur in healthcare settings or at home. Pressure ulcers are trauma to the skin and underlying tissue resulting from extended pressure on the skin. Pressure ulcers develop quickly in people who are immobile and bedfast. After wrongful death, pressure ulcers are the second most common claim, with more than 17,000 lawsuits annually. As a direct result of a pressure ulcer, about 60,000 patients die each year. Each year in the United States, pressure ulcers cost between $9.1 and $11.6 million. The cost ranges from around $21,000 to around $151,000 for each individual patient care per pressure ulcer. Medicare estimated that around $43,000 was added in cost to hospital stay for each pressure ulcer. Skin assessments and implementing certain interventions are top priority to prevent pressure ulcers from occurring. It is essential to follow specific pressure preventing instructions to cut down the cost of health care. The question that I want to answer in my research is in inpatient adults, how effective is the use of the Braden scale compared to other screening tools in predicting pressure ulcer development? The targeted population this research project will study is inpatient adults in an acute setting. In inpatient adults, the Braden scale is used each shift as an intervention to assess the likelihood of pressure ulcer development. The use of the Braden scale will be compared to other screening tools used in predicting pressure ulcer development. Preventing pressure ulcer development is the outcome hoping to be achieved within this research project. The design, setting, and sample. A quantitative research proposal will be utilized to investigate the use of the Braden scale compared with another preventative measure, the shape-risk scale, to assess the likelihood of development of pressure ulcers. The design will be an experimental study or randomized control trial using a pre-test, post-test design. The experimental group will have the Braden scale implemented to assess the likelihood of pressure ulcers, followed by the implementation of the shape-risk scale. The control group will have the shape-risk scale implemented to assess the likelihood of pressure ulcers, followed by the implementation of the Braden scale. The data to be collected will determine how effective the Braden scale is compared to the shape-risk scale in predicting the development of pressure ulcers. A total of 200 participants will be utilized for this specific research project. 200 of the participants will be placed in the experimental group and in the control group. Participants will be adult inpatients on a medical unit in an acute care setting. Registered nurses working within the acute care setting will administer the intervention protocol every 8 hours. Data related to the implementation of the Braden scale and the shape-risk scale will be collected over a 12-month period. Main characteristics of the sample will be older adults over the age of 65, be both of the male and female gender, weight not exceeding 200 kilograms or falling below 50 kilograms and in stable condition. Participants will be selected at random after meeting eligible criteria. Participants' rights and confidentiality will be maintained throughout the research project. Written instructions regarding the purpose of the study will be given to participants, along with a waiver allowing participants to withdraw from the study if he or she feels that their rights are not being protected or confidentiality has been broken. Participants will be educated about the Braden scale and the shape-risk scale and potential risks of receiving implementation of one intervention over the other. Informed voluntary consent will be obtained by signing a document containing the material participants will be educated about before starting the research project. Data collection and data analysis. The Braden scale and the shape-risk scale will be instruments used to objectively measure the likelihood of pressure ulcer development. The Braden scale. In 1987, Barbara Braden and Nancy Bergstrom introduced the Braden scale to assist nurses in the assessment process of identifying patients' risk of developing a pressure ulcer. The Braden scale will assess sensory perception, moisture, activity, mobility, nutrition, and friction and shear to identify patients at risk for pressure ulcer development. In 2008 and 2009, the shape risk scale was developed as a pressure ulcer risk assessment tool. The shape risk scale includes 5 risk assessment categories: mobility and physical activity, consciousness and sensory perception, body mass index, body shape, and body temperature, and will also assess patients at risk for developing a pressure ulcer. The effectiveness of the Braden scale compared to the shape risk scale will be analyzed using the chi-square test. The chi-square test is used to test hypotheses about the proportion of cases in different categories. The Braden scale will be implemented on the experimental group, and the shape risk will be implemented on the control group, classifying patients at a low risk, medium risk, or high risk of developing a pressure ulcer. The chi-square test will be used to determine the effectiveness of the Braden scale compared to the shape risk scale in assessing the likelihood of pressure ulcer development. In conclusion, pressure ulcer development is a major issue in healthcare. Treatment of the development of pressure ulcers is extensive and costly. Many negative patient outcomes are related to pressure ulcer development, such as extended length of hospital stay, increased healthcare costs, and even death. The topic of pressure ulcer development and the screening tools used to predict the development of pressure ulcers need to be researched due to the many negative outcomes patients may suffer from. By researching the effectiveness of the Braden scale compared to other screening tools in predicting pressure ulcer development may allow healthcare professionals to develop a more effective way in predicting pressure ulcers that may occur. In finding a more effective way to predict the development of pressure ulcers, patients' length of hospital stay may decrease, along with decreased healthcare costs and better quality of life. That end.